Hello, everyone. I am Elizabeth Trujillo, professor of law at the University of Houston, and I teach in the international economic law arena, as well as in sustainable development and first-year contracts. Welcome to our webinar today on constitutionalism, trade, social justice, and sustainability in the Americas, lessons from the 2020 global pandemic. I'm really happy to be able to do this webinar today as part of the launch of a new initiative at the University of Houston, the Global Law and Policy for the Americas. I'm really excited about this new initiative, which hopefully will provide a fresh look at the intersection of domestic law and policy and the ways that it has shaped and will continue to shape the global space and vice versa. You can learn much more about this initiative here on the website that's here showing on your screens. And one of the exciting things about this initiative is that it will allow for research and collaboration among other institutions around the world on various related topics where we can see this interplay of domestic law and policy with international law, specifically in areas like trade, investment, sustainable development, climate change, human rights, and comparative constitutionalism. So today I'm happy to collaborate with Professor Sabrina Ragone at the University of Bologna Center for Latin American Studies. Now, why do we have a webinar on constitutionalism, trade, social justice, sustainability in the Americas, lessons from the global pandemic? Well, we have seen that the global pandemic has affected us in many ways, personally, professionally, socially. It has affected our lives all over the world and in many different ways. And in the same way, it has changed the way society has been doing things. And it's also tested the limits of legal frameworks as we know them, both domestically and internationally. So we have chosen key areas as topics where we thought these shifts are most exemplified. And we wanted a comparative approach so that we could have a rich discussion with experts from the United States, Europe, and Latin America about the lessons that we can learn from these pandemics in key areas, in the hopes that it will lead to more discussion and examination and rebuilding and reconfiguring of these legal frameworks, and that can be better adapted for future emergencies, whether it's in the area of health or climate change or social justice challenges. So I'm very happy to introduce Professor Sabrina Ragone from the University of Bologna Center for Latin American Studies. She is an expert in comparative constitutionalism, and particularly as it applies to Latin America, and it really is a pleasure to work with her in co-organizing this event. I also wanted to thank the American Society of International Law, the Latin America interest group, specifically with their co-chairs who are here today, Cesar Coronel Ortega and Jorge Contese, who have generously offered to co-sponsor this event. So let me pass it over to my colleague and friend, Sabrina Ragone. Thank you.
Hi. So I hope you can hear me. Thanks, Elizabeth, for giving me the floor. As you have already anticipated, I teach comparative law at the University of Bologna, and in particular at the Department of Political and Social Sciences, which is where the Study Center on Latin America is based. You can see here on your screen the main page of the center. The center was founded already 8 years ago. It brings together lawyers like me, sociologists, political scientists, historians, and it really pursues interdisciplinary research and educational activities. It organizes events. It also edits and coordinates publications. Probably one of the most successful activities of the center is a yearly summer school, which is devoted to methodology in comparative law. On the website, you can find all the information. We are truly happy and honored to collaborate on this initiative with the Global Law and Policy for the Americas, and we are sure that this will be just the start of a longer collaboration to pursue further joint initiatives. Let me briefly say something about today's webinar, which is the one that is going to inaugurate this new series of webinars. This webinar addresses one of the most pressing issues related to the consequences of the COVID-19 pandemic, namely its impact on social justice. Our speaker today, Alberto Suarez Avila, will focus on the institutional flaws in the Americas that have determined the worsening of inequalities in the region. While today's discussant, Anousheh Farahat, will address this challenge from a European perspective. We also have today a moderator that I thank, who is Tessa Coronel Ortega. Let me briefly introduce him before I give him the floor, and he will be in charge of this session. He is, as it was already mentioned, the co-chair of the Latin American interest group of the American Society of International Law. He is a senior associate at the law firm Coronel and Perez in Ecuador, dealing with international disputes among many other fields. Previously, he worked at different law firms in London and New York, as well as the United Nations Office of Legal Affairs in New York, and he was also a legal advisor at the National Constituent Assembly of Ecuador. And he has taught international law in truly many academic institutions. I would like to thank Cesar again for accepting being today's moderator, and I'm going to leave him the floor. Thanks again for being here, and thanks to Professor Trujillo for being a great host.
Thank you very much, Sabrina. Well, I'm thrilled to be here, and I'd like to begin by thanking you, Sabrina, and Elizabeth, and the University of Houston and the University of Bologna for allowing us to co-sponsor this, this excellent webinar series, which is, of course, very relevant to our members, the members of the Latin America Interest Group of the American Society of International Law. And it's also a great way to collaborate among institutions that are interested in similar topics. So on behalf of my co-chair, Jorge Contese, who is here in the webinar, and myself, really thank you very much to you for allowing us to be part of this initiative. And of course, I'm honored to present our panelists today, Alberto Suarez Avila and Anousheh Farahat. Just to say a little bit about each of them. Alberto is he lives in Mexico City, where he's a full-time professor and coordinator of the Sociology of Law Department at the Instituto de Investigaciones Jurídicas of the UNAM, Universidad Nacional Autónoma de México. He's also a CONSTITUTIONALISM National Researcher, Level 2, and affiliate scholar to the Center of US and Mexican Law at the University of Houston Law Center. He belongs to several organizations, including the Latin American Studies Association, and he's published about human rights and the judicial system in Mexico. Anousheh is a professor of public law, migration law, and human rights law at the University of Erlangen-Nuremberg, and she is a senior research affiliate at the Max Planck Institute for Comparative Public Law and International Law. She is leading a research group currently on transnational solidarity conflicts in the EU, which is funded by the German Research Foundation, and she publishes widely on constitutional law, migration law, and human rights law. So it'll be interesting to see, Anousheh will have a lot to say about how the situation in Europe compares to the situation in Latin America, which is what Alberto will start telling us about. So without further ado, Alberto, the floor is yours.
Thank you very much, Cesar. Good morning, everyone. I want to start by thanking Sabrina and Elizabeth and the American Society of International Law for the invitation to be part of this webinar. It's for me a great pleasure to be here, and I want to wish Elizabeth the best luck on the newborn initiative on global law and policy for the Americas. I also like to remember our beloved friend and late professor at Houston, Steve Zamora, who always worked for a better understanding between our legal cultures. I'm sure he's very happy to see you, Elizabeth, taking up the baton like you're doing now. The conveners asked me to talk today about COVID-19 and social justice in the Americas as the first of the 6 topics we will discuss in this webinar. During the last year, COVID has been everywhere in this planet, causing sickness and death. As a world, we mourn the many human lives it has taken and the damages to many aspects of our daily life. The experience of the pandemic differs from house to house, town to town, and country to country. Unfortunately, the COVID has hit especially hard in our continent, particularly but not limited to our most vulnerable population. I like to use the minutes I have to present on social justice, trying to explain the severity of the pandemic on the Americas from our institutional deficit. Although a complete answer to this question requires taking other factors into account, like a geographical and demographical analysis, I hope that reflecting on our institutional context at least will help us to clarify the impact that the lack of adequate institutions have in the aftermath of the pandemic. Let's start with some data. Globally, as February 10th, there have been over 105 million people confirmed with COVID, including 2.3 million deaths. The American continent accumulates 47 million of confirmed cases, equivalent to 44.5% of the total. The region also presents the highest death toll with 1.1 million diseases, accounting for 47.5% of total fatalities. 4 American countries are in the top 12 countries with the highest number of infections. The United States goes first with 26.6 million, Brazil is third with 9.5 million, Colombia is 11 with over 2.1 million, and Argentina 12 with 2 million. The US with 500,000 deaths, Brazil with 250,000, and Mexico with over 160,000 deaths are the top 3 countries in the list of fatalities worldwide. To put this in perspective, 9 out of 20 people infected with COVID live in this continent, and 1 out of 2 of the diseases occur in this land. To be able to picture this tragedy, the continent represents only 1/7 of the global population. The effects of COVID are devastating for the economy as well. The global economy plunged into the worst recession ever measured by contemporary organizations. In 2020, the world had a negative growth of 4.4%. Emerging markets and developing countries contract 3.3%, while advanced economies did on an average of 5.8%. Along with the European countries, the Americas suffered the strongest decline in economic activity. The 4 largest economies in the continent showed important contractions. The United States minus 4.3%, Brazil minus 5.8%, Canada minus 7.1%, and Mexico minus 9%. Other countries in the region shrank at an even worse rate. Argentina minus 11.8%, Peru minus 13.9%, and Venezuela minus 25%. According to the World Bank's president, David Malpass, COVID already pushed over 1% of the global population into extreme poverty, between 88 to 115 million people. In the United States, a study conducted by the University of Chicago and the University of Notre Dame found that poverty rose by 2.4 percentage points, adding 8.1 million people to the ranks of the poor. For Blacks, poverty has risen by 5.4 percentage points since June. The US Bureau of Labor Statistics published that in January 2021, the unemployment rate was 6.3%, and the number of unemployed persons 10.1 million. Although they are much lower than their April 22 highs, they remain well above their pre-pandemic levels in February 2020. According to the UN Economic Commission for Latin America and the Caribbean, in 2020, Latin America poverty reached 231 million people, a 15-year setback, while extreme poverty reached 96 million, a 30-year regression. 8 of 10 people in the region live with a monthly income of less than $500. In Latin America, according to the same report, 47 million people lost their jobs during the lockdown, while 2.7 million businesses closed. 53% of the labor force works without the protection of a pension system, and 48% does not have health coverage. The pandemic also exacerbated the inequality in the region, already with severe problems of distribution. Before the pandemic, 20 Latin American countries were in the bottom 50 countries of the Gini index. It is expected that the Gini index grows 5 points in countries like Brazil, Chile, and Mexico, and more than 6 in Argentina, Ecuador, and Peru. Many countries have had previously reduced their index under the 50 line, but it's very likely that the pandemic sends them back. Although some countries have a universal healthcare system, most Latin Americans have large gaps in accessibility caused mainly by out-of-pocket health expenditure, which is 34% of total health spending. One of the biggest challenges that we are going to confront in the near future is the vaccination process. According to Bloomberg, so far 138 million doses have been administered in 73 countries. In the US, 10.2% of population got at least one shot and 3.1% have completed the 2-dose vaccination. Latin America has vaccinated its population in lower numbers. In Mexico, 0.5% of the population got at least one shot and only 0.1% have completed the 2-dose. In Argentina, 0.8% have received at least the first shot and 0.4% have completed the process. The numbers in the rest of the countries are even lower. The vaccination rate is around 5 million doses per day on average. 10 countries have received 75% of the vaccines. At this rate, it will take 6.5 years to cover 75% of the world's population, the magic number to go back to normality. The vaccination process already shows tremendous inequalities. Sorry. After looking at these numbers, the question I like to raise is, why is the pandemic especially ravaging towards our continent? Geography, demography, and other factors are important to answer this question, but I believe that looking at our institutional history helps. I think there is room for a reflection on our institutions to explain why this part of the planet has been especially vulnerable to the pandemic. During the Cold War, the Western Hemisphere placed their hopes in building a long-lasting peace on 3 pillars: free markets, democracy, and human rights. Although the pillars were not necessarily compatible, they help a notion of economic development with redistribution and controls. Along with unprecedented economic growth, the Western Hemisphere achieved an economic distribution never seen before. Workers were crucial to this development, gaining enough economic and political force to build a strong middle classes in most Western countries and having real weight in the political scenario. A big network of health, communications, and educational services were available for large portions of the population for the first time. The United States and Europe were at the center of the story, while Latin America was peripheral to it. Still, many places in the continent benefit from economic growth, being able to implement welfare policies. The end of the Soviet Union brought a global wave of changes. The US and other powers advocated for open markets and free movement of capital. The success of the Western economies motivated structural changes in many parts of the world, with special enthusiasm in South America, Latin America, and the former socialist countries. Many industries were moved to other parts of the planet. Also, technology evolved quickly in a global world. While capital expanded fast, democracy and human rights had less acceptance in the new economic model. Cheap labor available in many countries helped capital to be more efficient. This trend changed many institutions in Western societies. Labor lost its economic and political force, and the welfare state weakened. A global economy built new institutions, focusing competitiveness. The public space, an important part of the welfare state, started to fragment into private spheres. A small part of the population had the chance to experience globalization as it stops, while most people saw their protection and rights go away. In many countries, the promise of development with globalization never occurred. For the last 30 years, the welfare state has shrunken in most of our countries. Globalization made many markets efficient at a high social cost. The welfare state was substituted by the neoliberal state with a new agenda, promoting investment, ensuring security to capitals, and creating a network for productivity. Globalization helped to reach high levels of economic growth with big problems of distribution. The globalization process had a strong impact on politics too. It consolidated a liberal consensus which, for a long time, did not allow to challenge the principles of the economic model. There was very little room for other political options, usually disqualified for being considered out of context. In 2008, when globalization had its first downfall, we missed the chance to correct many failures visible in our institutions. The liberal consensus crumbled with the arrival of the Trump administration and other populisms in the region as an alternative to globalization disappointment, here and in many places of the world. This kind of populism did very little for building institutions, focusing on the centrality of the leader and his rhetoric. Many policies of the last years were oriented to increase the gaps in society. Tragedy took place in our countries when the pandemic arrived, among other reasons, because we believed that we could still rely on a welfare state as a safety net that hasn't been there for decades. Against the explanations that blame single political leaders for the disaster, I believe that the problem is somewhere else. Our societies have done the best possible to control the pandemic, and we need to recognize many people for that. From doctors and nurses to public officers and citizens, we witness every day that solidarity is still a foundational value in our societies. Nevertheless, our best efforts have not been enough. Our real problem is that we lack the institutional structures to successfully confront the pandemic. How can we rely on a health system that has been broken for decades? How can people stay at home when very few enjoy a salary, a social security, or even the stability of a formal job? Unfortunately, our health, economic, and social institutions were not prepared to face COVID-19, and building them in the middle of the storm is very difficult. In the US, for example, early in the pandemic, the federal government offered a relief package that included one-time stimulus payments to households and expansion of unemployment insurance benefits. But some of these benefits expire quickly, and others are set to expire very soon. CEPAL urged to take at least 7 actions oriented to tame the effects of the COVID in Latin America in the short term. Amongst the most important were introducing a universal emergency income, give credits to the small and mid-sized business with flexible conditions, and provide with a digital basic box, including a laptop or tablet, to those with no access to technology. None of the Latin American countries could follow that recipe. With health privatized in many countries, the state's finances broken, and the public space very limited, the responses to COVID-19, in fact, relied on the efforts of the population. Very few have resources to face the pandemic. Minorities, migrants, and vulnerable groups were disproportionately affected by the spread of the virus. The context shows that we were not prepared for a public health issue like this one. I hope that, at least, this experience helps us to understand that we need stronger institutions to be prepared when the next pandemic arrives. COVID-19 has proven our societies to be very vulnerable. We lack the institutions to confront this kind of disaster. Nevertheless, we need to think what to do to overcome the negative effects of the pandemic and to be better prepared to when the next global challenge hits. These are the questions that we will need to answer in the short to the medium term. The first step is to recognize that we need to strengthen our institutions and to start reversing the process of dismantling them. If we continue the path of social fragmentation, the next pandemic could be even tougher. As many of us, I'm far away from having a plan on how to do it. I'd like to share some ideas with you that might help to build better scenarios. I think it is urgent to rebuild the public sphere. Inequality, corruption, and violence are part of a broken society. Ultra-privatization has generated extremely expensive services accessible only to a little percentage of the population. The inequality in the continent is bad, not only for the poor, but for everyone, because it makes the access to basic goods like health or education very expensive for all. The pandemic could help to restore the social tissue if we understand that it's easier to fight the big social problems as one body instead of individuals. Our new public sphere needs inclusion for those that have been traditionally excluded, like minorities or migrants. Also, it is essential to set priorities to public spending. Enough support to universal access to public education and efficient health systems tops the list. Reducing gaps in technology is important too. Likewise, it is necessary to fund scientific research and cultural activities and rebuilding the physical public spaces. It is important to set new goals in the economy. Strong public institutions are economic development. Healthy, educated, and protected workers are as important as prosperous business. Get greener will help to avoid the next cataclysm. We need to discourage and prevent excessive competition in the global markets and look back to local economies. We need to protect the working class. The middle classes are about to disappear because the workers' rights are not protected anymore. Workers need contracts, a minimum wage, careers, health services, social security, a retirement plan. They need houses and credits and schools for their kids. They also need the opportunity to organize in behalf of their interests. These are rights, not privileges. Correspondingly, I think we need to open our democracies to new ideas and new people. For a long time, we have been afraid of ideas of redistribution as a legacy of the Cold War era. That attitude has helped the dismantle of the welfare state and the fragmentation of the public sphere. Every time there was a progressive government in a Latin American country, it lacked the support of the international community. Every time a progressive policy is promoted in the US, it comes with great cost for the proponent's career. We need a wider political spectrum where redistribution can be discussed seriously. The formation of new institutions will require democracy. It is an important time for new ideas, new proposals, and new actors. As a final note, I don't want to forget about lawyers and our role in the change. As lawyers, on the one hand, we have served the process of dismantling the welfare state, but on the other hand, we have advocated for more inclusion, opportunities to minorities, women's rights, and other changes in society. Although we love to present our cases as revolutionary, I'm inclined to think that lawyers, courts, and judges scarcely bring about social change. I lean towards the understanding of our profession as means of facilitating the rationalization of social processes. As lawyers, we need to bring cases to the courts because that helps the democratic process. That encourages the transit of ideas and public discussions. It helps us discerning a good policy from a bad one and to support the best understanding of our institutions and norms. Because of the former, I would like to see a generation of lawyers presenting cases, defending workers' rights, litigating for the expansion of the political sphere and the protection of a universal healthcare system. Also, I would like to see judges and courts in the region encouraging the advance of a social agenda that allows a better redistribution, a more rational public spending, and improving conditions for democracy. I think that we as law professors have a big responsibility to generate ideas and knowledge, as well as making the classroom into a space for discussion and free speech. I'm going to end up here. Thank you very much for your attention, and thanks again to the conveners for the opportunity to talk to you this morning.
Thank you very much, Alberto, for that presentation. Very interesting and a very thorough look through the impact of the pandemic in the world, really, and in our region. I wanted to take the opportunity to tell everyone attending the webinar, encourage everyone to post your questions in the Q&A function, using the Q&A function of Zoom. I already wrote that in the chat, and we already have a few questions. So thank you to those who have sent them. But please keep them coming, as we will have some time after Anousheh's comments to discuss the questions. So Anousheh, the floor is yours.
Thank you very much for the kind introduction. Thank you very, very much, Sabrina and Elizabeth, for the invitation. I feel really honored to be part of this opening panel for the new initiative. I really think that's an excellent panel, an excellent topic. And of course, I also wish your cooperation, but also especially Elizabeth, your project, all the best luck and success. And hopefully I will attend more of your sessions as the audience, so to say. So thank you also, Alberto, for the first part of this panel. I found it very interesting. So I had the privilege to already read your ideas a little bit earlier. And when I read them, I found it very interesting that it isn't so hard to contribute something from the European perspective, as many of your diagnoses, I think, also apply to Europe. So I know that there are a lot of differences in the degree of inequality and also in the forms of extreme poverty when we compare the two continents. But nevertheless, I think a number of the deficiencies that you identified, you can also see them in Europe. So I think from the bare numbers of deaths and infections, we are a little bit better off in Europe, but only a little bit. I mean, it's not that we really manage it quite well to manage or somehow to control the pandemic better in Europe. My impression when I look at the European debate is rather that in Europe, especially in the beginning of the pandemic, we had a huge arrogance of how we as the Western developed world will be able to be the best, those who are best able to actually cope with such a situation due to our developed healthcare systems and so on and so forth. And it was especially really one of the favorite activities of European journalists to blame the US for their horrible president and the way how they dealt with the pandemic, while we barely looked at our own situation, which was, not actually that much better, that it is really worth being so arrogant in such a way. So this is just my personal remark on the debate in Europe and how I perceived it. And I think slowly we start to realize that we also have some homework to do in Europe. And I think I would like to make 3 points basically, or 3.5. So, and they are basically also along the lines of what Alberto said, and just compare the points that he made to the situation in Europe. And I will try to keep this rather brief to not exceed the time that I have for my comment. So I will start with the first point, which is austerity and its legacy. So the pandemic hit Europe exactly in a situation where the last financial crisis, which started in 2008, was not really over, but we were still struggling with the consequences and of course also with the policies implemented to deal with that financial crisis. And the financial crisis, of course, as we all know, hit Europe's south hardest. And in particular, the austerity measures that have been the solution, which was promoted strongly by the European Commission, by Germany, and also by some other European countries, led to the result that many of the healthcare systems in countries of the European South, and in particular, for instance, in Spain, really had a huge problem in actually coping with the pandemic. So when the pandemic then hit Europe, it again hit Europe South hardest, and the public health care, and basically the public health care capacities in those countries were already limited and couldn't really cope with the situation, at least in the during the 2 or 3, depending on the counting, waves of the pandemic that we witnessed so far. Well, as a logical consequence of that, the pandemic also fueled again a debate about European solidarity, about public spending, and about austerity measures. So there was a fierce debate about the conditions under which the European Commission should establish a recovery plan. The core issue here was whether the Commission should grant loans or whether there should be grants, and what the conditions for that should be. So is there a strict conditionality or not? So there was really a huge political conflict about that. And it was more or less, to me, I had the impression it was basically the discussion that we already had the entire years before, but now under a really different context. So in a context where recovery was more deeply needed than ever before, but the blame game that we used to play the entire 10 years before seemed to continue. So that was my impression from that debate. Finally, I have to say that I was quite relieved that at least in some way the European Union managed to establish a recovery plan. Of course, one can always say that it's not enough and the conditions are difficult, but I think it was very important that at least in the end, a political compromise was reached, a compromise which included loans and grants, both, and a compromise which also includes not only 750 billion of loans and grants, but also 1.8 trillion through the EU budget to be spent at least in half, at least 50% of which is supposed to be spent for research, climate change, digitalization, health, and resilience. So I think that in the end, that this is a good result, but it's not a good result because it solves all our problems or because it's sufficient to resolve the economic problems that the pandemic created. But I think it's a good result because eventually I think that the position, the strong austerity position, so to say, that austerity is the only economic and monetary goal that we should pursue, is becoming weaker. I think there is really a shift in the political debate that in public investment and public infrastructure and the spending for those projects has much more legitimacy today than it has, for instance, 5 years ago. So I think that is really a shift, and it's a shift that we owe to the pandemic, because I don't think that otherwise the position of a country like Germany would have changed in such a way. So although there might also be some other contributing factors, but I really think that the pandemic was a game changer here. So what do I see as the greatest European deficit in the economic sense? I think the greatest deficit before the pandemic was the lack of European economic policy with a proper legitimization, with a proper justification. And I see a glimpse of hope here that this will change in the future. My second point is shorter, and it's about vaccination and how the European countries dealt in general with the pandemic. So my first observation is that something which Alberto didn't mention, so it would be interesting whether there's any parallel in the Americas. Of course, taken for granted that the context is different, but I see that in Europe, we really had a strong nationalization during the pandemic. So the first thing that was closed were borders, and it basically remained like that until today. So we could witness really a lack of capacity of the EU and also a lack of competences of the EU to effectively somehow regulate or develop the measures to actually combat the spreading of the virus. So therefore, it was basically national responses and not EU responses to the pandemic. Also, then when it came to purchasing the vaccines, I had the impression that the European Commission had the approach to establish a best practice example of solidarity in Europe by concentrating the purchasing at the European level, so that all European countries, even the small ones, would get their share of vaccines, which in general I think is a very laudable and good approach. But at the same time, it was of course full of difficulties. On the one hand, because the European Commission and the entire process were rather slow, and also some member states didn't want to spend so much money. So there was still the old thinking of, well, rather pursuing an austerity-based policy rather than spending much money in extraordinary circumstances. So it was a great idea in principle, but it was very poorly administered, so to say. And that, of course, led to a huge, well, to severe accusations of the European Commission and of the EU in general, a loss of faith and of trust in the EU as an institution, and also to increasing calls for national reaction, also to calls for controlling experts from the EU to other countries. So I think that this entire situation contributed not only again to further nationalization in the European Union, but also to the EU in general contributing to global inequality by forgetting about their own obligations to cooperate in terms of the right to health under the social covenant of the UN. So here I see the core deficit of a lack of supranational institutionalization on the one hand, because we don't have a strong agency with proper powers to actually organize and react in such a situation. So the existing European Center for Disease Prevention and Control is much too weak to actually do something powerful in such a situation. And I see a lack of global solidarity. Final point, internal solidarity and public welfare. I think here we see that the pandemic added to a situation which we owe, like Alberto already described neatly, to an area of neoliberalism, which changed the structure of labor, but also resulted in a lot of privatization of public services. And I think one of the core features of that situation is that the newly created class of care workers, which is usually very employed in under very precarious conditions and doesn't really receive a lot of recognition socially and also monetarily speaking. I think that is one of the core characteristics, and I think the pandemic in the beginning had the potential to change that, because it became so apparent that also the people working in the supermarket and working in the care sector, that they are so important to all of us. So I had the hope that maybe this could change something. My impression now is that, well, I think there are some changes, but they don't really translate into any economic change of the economic situation of the persons involved. So there is no additional money spent in that sector. But I think where we can see changes is that we have a new chance, or that the pandemic opened a new chance to at least raise the awareness of the relevance of public spending, of the relevance of public services, of the relevance of care work, and not only for solidarity as such, but also for our democracy. So I have the hope that we can speak about public goods and collective goods differently in the future, and I share that hope, I think, with Alberto. And finally, to the role of lawyers, because I found that was interesting that Alberto raised that as a separate point. I share his general hope that lawyers should engage in translating political and social conflicts into legal conflicts, often into constitutional conflicts. But I would like to add that I think lawyers should really, in a crisis like this, also insist on constitutional law as the core reference point and the core framework indicating also how we should deal and how we could deal with the crisis and how we can build public goods for the future. So that is the hope that I have, or the role that I would ascribe to at least constitutional lawyers. Not all lawyers need to do that. Thank you very much.
Thank you very much, Anousheh, and thank you to you and Alberto for being so disciplined with the timing. It's amazing how you've all managed to pack up so many ideas and interesting ideas in just such a short time. Alberto, so we have a little less than 15 minutes remaining for discussion, and we have a number of interesting questions from the attendees. But first, Alberto, if you want to take just a quick minute to sort of respond to any of Anousheh's comments, would you like to do that? I'm gonna hold you to the minute or so mark.
I would love to do that, because I think Anousheh's perspective is very important and complementary to start to see why this has happened in both continents, the continents that have been more affected by the pandemic. And as she said, the experience of globalization, it's been very intense in our continents, but I think they've been different in one aspect that Anousheh stressed, and is that while America continued with the globalization process without really creating institutions for that, at least the European Union built the European Union. And that makes a big difference, because when you try to discuss these things in the Americas, it's very difficult to find the right spot to do that, because we don't have it. I mean, when the CEPAL talks, it's a UN organization, it's important, but no one really cares about it. It's like going to mass and that's it. While in the European Union, you have institutions for doing that. You have a place to discuss these things. You have, although there have been a lot of criticism, and the austerity policies have been very strong, especially to southern countries. You have a place to do that. You have an organization that takes care of this process. While in the Americas, we couldn't build that. I think the closest we were was with NAFTA and with Mercosur, but both failed to go from a commerce organization to an integration structure. So I think that's going to be very important in the future, because many people is talking about going back to more regional economies. So if we're thinking on doing that, we need to build the structures and institutions to do that, because otherwise it's not gonna change very much. I think globalization is gonna stay, because this is a global world and technology allows it, and it's gonna happen. But we need to build those institutions. And of course, when Anousheh talks about vaccination and policies of vaccination, you will see that at least there is a horizon where the European countries can look at and try to follow and find support. While here in the Americas, you will see that the economic powerful countries like the United States or Canada or Mexico can have access, but other countries, they don't have the minimum chance to be in the queue. So thank you very much, Anousheh. I think your comments were very, very, very important to discussion. I would love to continue talking about these topics, because it's really important.
Thank you, Alberto. So we have, like I said, a number of questions. We unfortunately won't be able to get through all of them, but one topic that has evidently raised interest among our attendees is this issue of the role of lawyers and sort of what we can do in our realm, right? So one comment from Pedro Villarreal asks to Alberto, he says, you emphasize the role of lawyers in bringing cases to the court. And do you have any views on the rulings that judges in the region have made regarding COVID-19? could they address systemic institutional deficiencies that go beyond the individual cases, which is, what usually amparos do. And then we have a related question from an anonymous attendee who's saying that establishing a public safety jurisprudence that would allow for better developed public health protocols to cope with these situations could have saved hundreds of thousands of lives, as it did in the Republic of Korea. And so we, the nations of the Americas haven't properly confronted a potential check on individual liberty in the face of a pandemic, says this comment. And so what could we do about it? So I think those two questions are related, the role of judges and the possibility of establishing a public safety jurisprudence. So what do you, Alberto and Anousheh, think about that? Let me give you a chance to respond first, Alberto.
Okay, thank you very much, Cesar. Well, as I said, I'm not a big believer of the possibility that courts can bring about meaningful social change. I think they just, they follow the political processes, and the things they can do is reinforce the policies of the political powers, or kind of veto them for a little while if they have enough force to do that. So I won't pay much attention to what's happening right now in courts, because I think the important field is going to be the political field. Although we are lawyers and we love to think that we can we can present the landmark case that's going to change history. I don't think this is going to happen. I think, especially because if we look at how our institutions are working right now, I think it's going to be a big political debate. If you look at what's going on in the world, it's very unlikely that the most important leaders before the pandemic would survive the elections after the pandemic. So we already are in a moment when big changes are taking place in the political sphere. So I won't be very, very excited about what could happen in the courts, but I think it's going to be important that when these policies that the new processes reach the courts, we have the lawyers and the judges that are capable of distinguish one good policy from a bad policy, and to distinguish which is something that could be a base or a pillar of the new understanding of how we are going to deal with issues like this. I'm not very excited. It's weird because I'm a lawyer, I study courts, but I'm not very excited about what they can do. I think it's their role is not that important in moments like this one. I think politics and politics in a different place, it's gonna have more importance in the next years. And just as a note, the judicial branches, at least in Mexico, they've been very quiet during these times. They are trying to be not very visible, and I understand that's because they are also hesitating of establishing a very important role in this process.
Thank you, Alberto. Anousheh, any comments on that?
Yes, thank you very much. I think here I really have a different or slightly different take than Alberto, which makes it even more interesting to have this conversation. I think my impression is that courts have a very important role in at least some European countries at the moment, not so much in remedying the structural problems that Alberto and I identified, but more in the sense that they have the task to prevent the legislature and especially the executive from overreaching into or for interfering too much and in unjustified ways into basic civil liberties. So, because I mean, it's not only social rights; it's in particular also all the other fundamental rights that are affected at the moment through the measures of lockdown and curfews and whatever. And I think here the courts play a very important role to stress the relevance of proportionality, to stress also the relationship between different constitutional values and rights and fundamental rights. So I think there they play a very important role. But I share with Alberto the skepticism that they can remedy the structural deficits and problems that we're facing at the moment. I think that was different, for instance, in Europe during the Eurozone crisis. I think during that crisis, it would have been possible for courts to do more and to stress social rights in the way how the European governments reacted to the crisis. But I think now, since it's also and predominantly an institutional deficit, I think it's not for courts to build up institutions. That needs to be necessarily a political process. So there I'm with Alberto in that respect. And but I think that does not mean that lawyers cannot do anything about it, because lawyers can, of course, contribute to how to set up institutions, what their powers should be, how you could structure those powers. I think lawyers and legal analysis can be useful here, but it's not going to be changing through court decisions, I think. And that also applies for the remark on Korea and the public safety jurisprudence or public safety protocols. In general, I think we should learn. We can learn a lot from how countries like Korea handled the crisis. I think that would be very useful if we had a closer look on that. But I think I don't think that this is going to happen through case law.
Interesting. Well, thank you very much, Anushe. Unfortunately, we have only 2 minutes left, so we really don't have time to discuss the other very, very interesting questions that people have posed. I will just say very quickly, people have asked about, what's the case of Cuba, what about Cuba? How does the case of Cuba compare to the rest of Latin American countries? There's lots of questions about the role of politics in the particular intensity of COVID in certain places. People have mentioned the case of Mexico with the López Obrador government, the case of the US with the Trump government, which was mentioned a little bit, the case of Brazil with Bolsonaro. And with respect to Alberto's comment about their international reaction to progressive governments in Latin America, so people said, okay, well, there's been some differences as to how people have responded. There's been a different response to Chavez in Venezuela than, for example, to Bachelet in Chile. Anyway, lots of food for thought, lots of interesting questions, which unfortunately we won't be able to discuss now. But I just wanted to thank everyone who's participated and who's asked these questions, and hopefully we will get into some of these topics in the next webinars in the series. So thank you very much again to Alberto and Anushe for a very interesting discussion, and thank you to all who have attended. I'll just hand it off to Elizabeth and Sabrina to close things off.
Thank you, Cesar.
So thank you so much, Anushe and Alberto, for this fantastic presentations. I think you brought up so many interesting areas that need to continue to be discussed. And Tessa, thank you so much for moderating and for keeping track of all the questions, and definitely stimulating the conversation with your great moderating and keeping us on time. I just wanted to say quickly, there were so many key points here, but some that really, really struck me were with respect to the need for institutions and reframing the institutions we have, but perhaps more institutions, both globally as well as at the regional level, as well as domestically, but the regional level in particular. This shifting of public sphere to the private has been intensified with the pandemic. And what does that mean for the future? And what do we mean by public goods in the future? The continued challenges for access to health supplies, vaccinations, general services, basic services, jobs, right, for the most vulnerable communities, for all of us, but in particular for most vulnerable communities all over the world. And it manifests in different ways, but that is a common theme that we see. And so we have to rethink sort of the welfare state and what is the role of the government vis-a-vis the private sector. And of course, the role of lawyers and judges and courts, but also politics, how much that has taken the forefront of this entire pandemic and moving forward. I wanted to just say a few words about the rest of the series, which will be coming up. The next series will be February 25th. The impact of COVID-19 pandemic on international and global law. You can go to the GLAPA website to register and to find more information. We have a fantastic group of speakers for that day as well. We will try to continue some of the themes, build on the themes of each seminar as we move forward, because we want to try to create important linkages here as we explore this important topic. So you will see that we have speakers from the University of Andes, Bogota, Colombia, René Ureña, and as well as discussant Lorenzo Cassini from the IMT School for Advanced Studies in Lucca, Italy. So I am really looking forward to continuing the conversation. Thank you for those of you who have attended, for your wonderful questions. Thank you again to our panelists. Please join me in thanking our panelists. Thank you, Sabrina, as well for your collaboration. It's always a pleasure. And I don't know if you wanted to say a few words before we say goodbye.
Let me just thank everybody, our speakers, our moderator, and you. And we'll see you all in 2 weeks.
In 2 weeks. Thank you. Bye-bye.